Madam Speaker, H72 is an act relating to harm reduction, criminal justice response to drug use. Formerly known as the Safe Injection Sites Bill, this bill will sanction use of a federal illegal drug or drugs. Currently, there is one state in the nation, actually one city, New York City, that has stood up an unsanctioned safe injection site. Two sites, both located in Manhattan. The area served in Manhattan for these two sites encompasses a population more than twice the size of Vermont. The infrastructure to support these two sites is already in place in New York, the city of New York. The health officials needed to operate these two sites are readily available in the city of New York. While our state needs to address the exploding use of illegal drug use and expand strategies to prevent overdoses, the results are unclear if safe injection sites will achieve those goals. We have evidence-based strategies, which I believe we should be expanding instead. Our own health commissioner stated, this bill is like flying a plane while it is still being built. The government sanctioning and encouraging illegal drug use is something I cannot support. I will be voting no.
Madam Speaker, as many of my esteemed colleagues have pointed out, this bill fails miserably in doing its due diligence. We have not only left addicts who are suffering without options for immediate treatment at these sites, but we also do not have the staff or capacity to run them. So many times in this building, we seek to pass legislation that addresses a problem, only to find that we are creating bigger problems. In 1998, my cousin passed away from an overdose. In 2018, another cousin of mine passed away from an overdose, leaving behind two young children. I understand the acute need and urgency to solve this problem. We can and will make a difference, but this is not how we do it. Passing legislation that has not engaged critical stakeholders, medical professionals, and law enforcement in their entirety is not a way forward. Passing legislation that does not allow our communities to choose if a center is what is right for them is not a way forward. And passing a bill full of vagaries that make it dangerous is not the way forward. We're creating a situation where valued human beings are being seated on a plane with no pilot, no engine, and no wings, and are expected to successfully get off the ground. For these reasons, I will be voting no on H72 and urge my colleagues to instead create and pass legislation that will effectively address these problems, not create bigger ones as this bill does. Thank you, Madam Speaker.
There is inadequate evidence that a safe injection site will save lives versus losing lives. Because we proceeded without the evidence-based studies and without strong, engaged local leadership and well-documented, vetted, and thoughtful operation and sustainable plans, which we should strive to ensure our initiative efforts are well-planned even when they start as pilots to help mitigate the potential and unintended impacts and consequences. At this time, the state of Vermont does not have the adequate substance abuse continuum of care infrastructure required to support an overdose prevention consumption site. We need to make the investments into prevention, education, recovery, and treatment. These are the evidence-based, trauma-informed practices, best practices that save lives and bring our loved ones home to us safe, stable, and healthy. For this reason, I will be voting no on H27, and I encourage this party to do so the same. Thank you, Madam Speaker.
Well, I mean, people are snorting fentanyl and smoking it, and I'm just wondering if that will be allowed at the centers, and also something like smoking methamphetamine.
Madam Speaker, yes, people who would be using such facilities would be able to use pre-obtained drugs in a variety of ways.
Thank you.